So we start off this week with the ulna. So here you see the ulna and the radius. So this is a left ulna and radius, ulna, radius. So we'll start with the ulna. The olecranon process is your elbow. So if you flip to posterior side, olecranon process is right there. The coronoid process is going to be the other one. It's going to be this little process here. So the anterior portion. Actually, I'll start using this. Coronoid process. Olecranal process. Then the trochlear notch is right there. The radial notch is going to be right here. It's where the head of the radius fits into the ulna, the proximal side. And then the styloid process is down on the distal end of the ulna. It's going to be right there. So they fit together just like that. And then if we're looking at the radius, this is the head of the radius, this little cylindrical part. The radial tuberosity is right here. Remember, tuberosity is a rough like section, rough portion of it. So right there. The styloid process, again, so the radial styloid process is right down here, this little process. And then the ulnar notch is going to be the notch into which the ulna fits, down at the distal end. So right there. Remember, the radial notch is at the proximal end, and the ulnar notch is at the distal end. Now we're on to the hand and wrist. So for the carpals, I gotta sneeze. No, it's not gonna happen. Okay, carpals are up here. They form your wrist. They're all short bones. The lunate is this small one right here. So the lunate and the scaphoid are the two most superior, or I guess proximal carpals. You can think of them like that. So the lunate is this small one right here. I guess that's not anatomical though. So this is an anatomical view. So the lunate is right there, and then the scaphoid is right there. No, wait, was it? Mm-hmm. This is right. Yeah. So this is, yeah. So that's the lunate, scaphoid. Then if we're looking at the metacarpals, it's these 5 bones right here, directly inferior to the carpals. Then the phalanges are your finger bones. So thumb, index, middle, ring, pinky. The thumb only has a proximal and a distal phalanx, but the other 4 fingers have proximal, middle, and distal. So you have 4 proximal, 4 distal, or 5 proximal, 5 distal, and only 4 medial. Cool. So that's the hand. Now we're onto the pelvis. So fitting the pelvis together, it's going to look like this. And then a good way to orient yourself left versus right is to always look at the acetabulum. So the big old notch where the femur fits in, the head of the femur. So if we're looking at the pelvic bone, last week we went over the coxal bone, so the sacrum and the coccyx will fit in the back there, so in that gap in the back. We saw that last week. So the ilium of the pelvis is right here, this section. The pubis is this section, the sort of anterior inferior section, and then the ischium is this back section, so the posterior inferior. And then, as I was saying before, the acetabulum is right here where the head of the femur fits into. So on the ilium, the iliac crest is going to be this section right here. So this, I guess, superior margin, you could think of it, of the ilium. The anterior superior iliac spine, so anterior superior right here. So this spine right there. Then the posterior superior iliac spine, posterior back, superior up. That one's broken. Let's look at this one. So reorient ourselves. This is the other side. So posterior superior is right there. So this is the posterior superior iliac spine. The greater sciatic notch is right in here. So this is the greater sciatic notch. The iliac fossa is going to be this whole sort of flattened, smooth part here. Then the auricular surface is going to be this part right here. So we had the posterior superior iliac spine here, and then beneath that is the auricular surface. Cool, then on to the ischium. So the ischial spine is right here. It's a little bit broken off here, but you can still see it. That's the ischial spine. Recall the ischium is the posterior inferior portion of the pelvic bone. So that's the ischial spine. The lesser sciatic notch is directly inferior to the ischium, or is the ischial spine, so lesser sciatic notch. The ischial tuberosity is directly below that, so it's the rough portion of the ischium right down here. Then the ramus, remember a ramus is a projection off of an angle, so here's the angle of the ischium, then the ramus projects right off of that, so it's this half of this kind of whole line right there. So that's the ischial ramus, I guess. The obturator foramen is this foramen right here, this big old hole. And then, as we saw before, the acetabulum is right there. Then the pubis was the inferior anterior portion. So the superior ramus, remember ramus is a projection off of an angle, so here's the angle. Superior is up there, and inferior is down here. Cool. So that's that boy. Then for the femur, right here. So a good way to orient yourself in the femur. Here's the head, right? These are the trochanter, greater and lesser. So lesser trochanter always faces the back, and the head is always medial. So that means this is going to be a right femur. So, as I said, this is the head of the femur. The neck is directly below the head, the skinny portion here. Greater trochanter and lesser trochanter. Greater, lesser. Linea aspera is in the back, so it's this line along the posterior shaft of the femur. Then the medial and lateral condyle. Medial condyle, lateral condyle. The intercondylar fossa is going to be this fossa here. So this little wedge right in between them, this little valley kind of thing. The medial and lateral epicondyles, they're not super great on here, but if you're looking on the skeleton, so here's the femur. Medial epicondyles, this little tiny projection on the condyle. And then the lateral epicondyle is this projection on the lateral condyle, lateral epicondyle. It's right there. And then finally, the patellar surface is right where the patella fits in. It's going to be right there. So that's where your kneecap is. Then the patella is this tiny little short bone that fits in. I think the way that it goes is like this, maybe, or actually, yeah. So yeah, it's gonna be right like that. Yep. Cool. Now on to the tibia. So the way the tibia and the fibula are oriented is like this. One way that I was like that. Sorry. One way that I was trying to think of it is the if you look down here at the malleoli, so the medial malleolus and the lateral malleolus are sort of the distal ends of the tibia and fibula. And the medial malleolus obviously is medial, it's on the tibia. If you orient yourself that way, with this tubercle facing you, that kind of gives you the idea. So the tibia is always medial and the fibula is always lateral, so that means this is a right tibia and fibula. So like I was saying, medial condyle, for just looking at the tibia, medial condyle is going to be this guy right here. Lateral condyle is going to be this guy right here. Then the intercondylar eminence, it's going to be these bumps sort of right in between the two condyles. So the articulating surface of the medial condyle, articulating surface of the lateral condyle, these two bumps in between them. Then the tibial tuberosity. Remember, tuberosity is a rough portion for muscle attachment, so that's the tibial tuberosity. And then medial malleolus, right there, right at the bottom. And then the fibular notch is right here where the fibula fits in. And so recall, this is kind of how the two fit together. So now if we're just looking at the fibula, the head of the fibula is the proximal end of the fibula. And then the lateral malleolus is the malleolus down to the very end, the distal end of the fibula. Then, if we look at the tarsals, so we're actually missing our calcaneus, so we're going to look at the good old-fashioned skeleton. So, tarsals, obviously, if you're thinking your wrists, these are the tarsals, your ankle bones are your tarsals. So this is the calcaneus. It forms the heel, the calcaneal region, which is your heel. And then the talus is directly superior to that. So this here's the talus, and this is the calcaneus. Talus, calcaneus. And the talus articulates with the tibia and fibula. Mostly with the tibia, though, actually. Cool, so those are your tarsals. Metatarsals, again, same as metacarpals. Form the palm of your foot, if you're thinking in terms of your hand. So that's your tarsals, and then your phalanges are your toesies. And once again, this little piggy has only got two. He's got the proximal distal, and then the rest of the little piggies have all three. We got proximal, medial, and distal. So that's your feet, and that's the whole skeleton.